if you would like to just introduce yourself, tell us who you are and what you do.
Of course. Hello, Kate. I'm Eleftheria, and I'm a complementary medicine instructor. I specialize in herbal medicine. So I thought that it would be nice to discuss as today's topic, tongue diagnosis and herbal medicine. This comes from traditional Chinese medicine. From this tradition, I have worked a lot on it, and I believe it can be incorporated very easily in Western herbalism as well.
That's really interesting. So do you want to tell us a little bit about the sort of the history, the significance of
Yes, of course. First of all, tongue diagnosis is a part of traditional Chinese medicine, along with the pulse. It has been used for thousands of years in traditional Chinese medicine, and this diagnostic technique actually dates back to the Han Dynasty. Somehow the tongue in Chinese medicine is kind of considered like a microcosm of the body, yes? And it reflects the state of the internal organs. It can also say a lot of things about our blood circulation and some energetic imbalances. Of course, because the tongue is part of the digestive system, it relates a lot to the condition of the stomach. As an organ and to our digestion, of course. So, of course, Western medicine relies heavily on lab tests and imaging, but, traditional Chinese medicine uses a lot like external science, because, of course, these modalities like lab tests and imaging didn't exist back in the day. So, it's a part of traditional Chinese medicine along with pulse diagnosis, and it's a tool of internal health assessment.
That's really interesting. So how can that then sort of help to maybe bridge the gap between, you've got obviously the traditional Chinese medicine, you've also got the Western herbalism as well?
Sure. It's actually a very tangible tool because, in Western herbalism, like herbal selection is often based on symptomatic things, like it's based mostly on symptomatic relief and biochemical actions. However, traditional Chinese medicine, its herbal aspect, it focuses a lot on underlying energetic patterns and has some terms like, maybe you have heard these terms again, like chi stagnation, dampness, fire, and all these weird terms that require like a basic training in traditional Chinese medicine for someone to comprehend them, because it's a model of understanding the human body. It's not so difficult to actually grasp it, So if a Western herbalist sees like a swollen tongue, a Western herbalist may think that the person has something like poor digestion or a sluggish metabolism. So a Western herbalist could choose some like herbs that aid digestion, like taraxacum, or gentian root, etc. But a Chinese medicine herbalist, if they could choose mostly like aromatic herbs, like tangerine peel, for example, or ginseng, or astragalus even. So and because Western herbs also have an energetic profile too, somehow tongue diagnosis can also be used as a tool for Western herbalism also, in order to work better with energetics of herbs. Because this allows a herbalist to work with deeper constitutional needs rather than just a more superficial symptom relief.
So what maybe are some of the sort of maybe the key features that a herbalist would be looking for in sort of tongue diagnosis?
First of all, a herbalist asks the person to show the tongue for like 15 or 20 seconds. That's how long this lasts. And obviously, the person shouldn't have eaten something that colors the tongue, like turmeric or coffee. Yeah, obviously. So the morning is a good time to check the tongue. So what we're looking at the tongue. First of all, we're looking at the color the tongue body has. Yeah, and in Chinese medicine, we say that this indicates the state of blood, as this is understood in traditional Chinese medicine, and qi, which is like the basic energy and the basic metabolic functions of the body. Yeah, so if a person has a pale tongue, this could suggest blood or qi deficiency. Yeah, or like a scarlet color could indicate like a chronic state of inflammation. That's because the color of the tongue body changes very slow. It has a very slow pace of changing. We're also looking at the coating of the tongue. Yeah, the coating of the tongue can reflect the state of digestion and some pathogenic factors as well. Like if the person has a thick white coating, this can indicate the presence of a lot of toxins in the digestive tract, but it can also indicate that there is an external pathogenic factor. Let's say something like a cold or a flu. Actually, this exists in Western medicine also. The thick white coating can definitely indicate that. Then we're looking for any cracks on the tongue, yeah? Because cracks on the tongue can indicate like chronic deficiencies or even some constitutional deficiencies. And we're looking at cracks at the tip of the tongue or like a central crack. There are many types of cracks on the tongue. We would also look for spots or patches on the tongue. Yeah, it's interesting because it's quite common to find like red spots on the tongue, which could also indicate things like chronic inflammation, or if they are located at the tip of the tongue, they could also indicate very severe stress or even chronic insomnia. And we're also looking at the shape and the moisture of the tongue, because if the tongue is swollen, that could mean that the person may have a poor digestion. And we're also looking at the motion of the tongue. Yeah, like if the tongue is trembling, that could mean that the person also has had like severe stress for a long time. Yeah, so basic things.
Yeah, no, that's great. So how then would you use this tongue diagnosis method if you were going to select sort of a herb from sort of maybe in Western herbalism? How would you use that?
Mm-hmm. If I see that there is what Chinese herbal medicine defines as inner cold, yeah, I would not suggest to the person to take a herb that's cold in its energetics, like, for example, gentian root. Yeah, I would not suggest that, or lemon balm. So I would choose some warming carminative herbs, like ginger or fennel seed or even tangerine peel. Or if I see that the person has a red tongue, which is a little bit shaky, or even has a few like red spots on the teeth and stuff like that, in that case, I could prescribe a herb that somehow cools heat. That could be a herb like Scutellaria root, that's skullcap, yeah? Or perhaps something like Betonica, which is Stachys officinalis. Like a few examples of that. Or perhaps if I would see that the person has a purple or blue tongue coating and there is a chronic respiratory issue, maybe I would suggest to the person to take a herb like thyme or elecampane. Yeah, it goes like that. Just a few examples.
Yeah, that's
I
great.
don't know if all this stuff sounds too weird.
No, not at all. No, it's really interesting. So in traditional Chinese medicine, they obviously, they I don't know have some sort of herbal formulas. So could you maybe share some examples of how those, might align with sort of tongue
Yes,
patterns?
yes, of course. Of course. First of all, it's always interesting to combine Western herbs with Chinese herbs. Yeah, and if someone lives in Europe, like I do, in the European Union, because of this Codex Alimentarius law, some herbs which are legal in Asia or even in the United States and Canada, they are forbidden in the European Union. These herbs, we call them herbs, but they're actually, they could be minerals. Some of these substances, substances would be a more proper name. So it's interesting to actually substitute some of these substances, or even some Chinese herbs which are difficult to find. But there are some Chinese formulas which anyway include some Western herbs. One of these formulas is called in Chinese Longdan Xie Gantan. That's a Chinese name. And it's a formula that has gentian root and also skullcap. And there are many formulas that also include herbs that are also used in Western herbalism, like ginseng or tangerine tea. Just a few examples.
Yeah, that's really interesting. So if you're, giving someone a course of herbal treatment, so you can monitor changes in tongue features over time. So does that then, help to show its effectiveness?
Yes, of course. This is always very interesting to observe. Like sometimes a person can come for a herbal treatment and they can have a very purple tongue. And I have even seen people with dark blue or even gray or even black tongues. So I have seen very often that when you administer some herbs to this person, the color of the tongue body improves a lot. Like these dark colors usually suggest a kind of qi stagnation. And when this color changes, this usually means that there is an improvement. I have actually seen these things happening, but of course, these changes take time, like at least 2 or 3 weeks. What is easier and quicker to change is the coating of the tongue. Like a thing I have seen very often is people that have toxins in the digestive tract and have a yellow or white greasy coating. So if a herbalist administers the correct herbs, this coating should fit and normalize. I have even seen a coating, like very, very thick and greasy coatings, disappear after 1 week with the correct herbs. And also the tongue coating can change very quickly when there is a flu or a cold. In that case, the coating can change even within a day. If the person takes the correct herbs, like something like an echinacea tincture, perhaps, or a very hot tea with ginger and cinnamon.
Yeah, that's really interesting. So are there then maybe some misconceptions about tongue diagnosis?
Yes, certainly. A common misconception could be that tongue diagnosis is something like a one-time assessment, when actually it's something that evolves when health changes. Like when it's what we said before. Like when the health of the person improves, the picture of the tongue can also change a lot. Another misconception is that some features of the tongue, like a tongue which is permanently cracked, that some people may think that this is a pathological feature, which actually can be constitutional and not necessarily mean something serious. Another misconception is with some external and lifestyle factors. The truth is like our diet, some medications people take, or even dehydration, these factors can influence tongue appearance, so context is always key.
Yeah, absolutely. So would you say then there are some limitations to tongue diagnosis?
Limitations, yes, certainly. And some limitations are that sometimes when a person takes certain medications for a long time, these medications can affect the person's health in a way that cannot be observed in the tongue. Another limitation is that in some cases it may be necessary to actually observe the pulse also, additionally with observing the tongue. And if you're really good at tongue diagnosis, it's actually possible to work with a person even online or at a distance, because you can ask for the person to send a tongue selfie, as I call it. Yeah, it's weird, yeah. It's weird to ask someone to take a selfie of one's tongue. And but sometimes this is not enough. You actually have to see the person, because in some cases, it's what I said before, the tongue can be shaky. And this cannot be reflected at a tongue selfie. Yeah, or sometimes it's also useful to actually assess the expression of the person. Yeah, because the person's look, the person's voice tone, the person's skin tone, or the language of the body can also tell us a lot of things which are not obvious, of course, only from the tongue.
Yeah. So it would be, maybe most useful to have as part of a whole, sort of holistic assessment.
Absolutely.
Yeah. So, what are your tips then for practitioners if maybe they want to integrate, tongue diagnosis into their practice?
What I do is that I keep a file. It's actually a very plain Word file where I place the patient's tongue, the tongue selfie, and next to this, I write their history, and the herbs I also administer. This is a very useful tool, to keep as an archive. Definitely. And it's also very useful to actually self-monitor one's tongue, because it's a very useful tool to detect changes in oneself. Yeah, like if you detect some changes in your digestion, hydration, or if you know that you have a systemic inflammation, it's always a good idea to self-monitor the condition of your tongue. And it's actually nice to encourage people to track tongue features, because in this way, people can also understand how herbs influence their health. Yeah, keeping like a tongue journal is always a good idea if you are into this thing. I also have observed that when you incorporate tongue diagnosis in your herbal practice, this allows you to be much more accurate, because it allows you to have better results, This is what I have seen, like from my experience.
Yeah. That's excellent. So you mentioned people there, tracking it themselves at home. So yes, that's something that people can sort of see something about their own health from.
Yes, of course. And I believe that this can be a very useful tool also. I mean, I'm not encouraging anyone to replace medical care with self-monitoring the tongue, yeah? But it can also be a useful tool. Also, this came to me because I actually live in Greece, yeah? And Greece is a country that has many small islands in the Aegean Sea and stuff. And some of these islands actually don't have a doctor, and medical care is very sparse there, and also there are many remote areas. So when there is no doctor available, it can be a useful tool to monitor one's health until medical care is available.
Yeah. If people want to find out more about you, maybe follow you online, I mean, where can they find you?
They can find me with the handle Flow Athens. It's a single word, and with that handle Flow Athens, you can find me on YouTube, Instagram, and Twitter. I'm quite active there, and from October 2025, I also plan to do an online class on herbal medicine that may include what we discussed today. So I'm looking forward to it.
Oh, that sounds great. Yeah. Well, best of luck with that.